Hello, so it is Sunday, September 25th, 2022. For those of you who are new here, I have inattentive ADHD, cerebral palsy, major depressive disorder, and generalized anxiety disorder. In my channel, you'll find medication updates. I've tried about 1 million different medications, stimulant and non-stimulant for ADHD, and a bunch of different antidepressants and even some mood stabilizers at some point, and I've reviewed them all in my channel if you want to check them out. This is a quick medication update. I have been on the antidepressant Trintellix and the stimulant medication mydayis for ADHD for a couple of months now. And about a month ago, I increased the dose of my stimulant medication. So I increased the mydayis dose from 12.5 to 25 milligrams, and it was making me nauseous. And initially, I thought that I was probably experiencing nausea because I wasn't taking the medication with breakfast. And even though my provider didn't say anything specifically about me having to take the stimulant medication with breakfast, but then I tried taking it with breakfast and the nausea just wouldn't go away. And so I saw my provider a couple days ago, and I brought up that ever since she had increased the dose from 12.5 to 25 milligrams, that I was feeling nauseous. And she said she thought it was weird because that's not generally a side effect of the stimulant mydayis, or at least not in her experience and what she has heard from different patients. She asked me if I wasn't sure if it was maybe a side effect of her increasing the trintellix, because I am currently on 10 milligrams of trintellix, which is the antidepressant. And a couple of months ago, I started off on 5 milligrams, and a couple of months ago, she increased it to 10 milligrams. And I said, I'm pretty sure it's the stimulant, because otherwise I would have noticed the nausea when you increased the antidepressant a couple weeks ago, right? So it's right around the time when she increased the dose of the stimulant medication that I started feeling nauseous. And so she said, okay, we'll go back down to 12.5 and let me know if that helps with the nausea and if it subsides. So this is my second day of taking the 12.5 milligrams of mydayis after she decreased it, and I'm surprisingly, or not surprisingly, not feeling nauseous, which is great, but I am feeling more tired than usual, more lethargic, and I'm assuming that's because I went from the higher dose of the 25 milligrams down to the lower dose of 12.5, and is basically half of the dose that I was taking previously. So I'm assuming that my body's just gonna take a little bit of time to get used to being on a lower dose again, on the 12.5. And also, I started seeing a new therapist. I've only seen her once so far, but I mentioned this in a previous video that I had been seeing the same therapist for about 3 years, but because I recently had a change in my health insurance and my previous therapist doesn't take this new insurance that I'm on, I was unfortunately forced to look for a different therapist that would be in network with my current health insurance. And that really sucks because I was just so used to seeing my previous therapist. And initially, when I changed insurance, I emailed her and I said, is there, because I still had, okay, the insurance that she takes is IEHP, which is an insurance that is pretty common in California. It's part of Medi-Cal. And so I still have IEHP, but I have it as my secondary insurance, and I now have Anthem as my primary insurance, whereas before I got on my Anthem plan, I just had IEHP by itself. So I emailed my previous therapist and asked her, is there any way that maybe you or the place that you're working for, if you guys could bill my secondary insurance, which is IEHP, which is the insurance that she takes, as opposed to my primary insurance. And she said the current place that she was working at doesn't really do much as far as advocating for clients for insurance to get accepted and whatnot, but she said she does work at a different facility as well, and that person who's in charge of billing insurance at this different facility that she works at might be able to ask for a letter of denial for my primary insurance, so then the cost could go to my secondary insurance, which is IEHP. It's kind of a little confusing, but essentially she said that a second facility that she works at might be able to do something in terms of getting her services approved so that I could continue seeing her. And she said, let me know if this is something that you would like to do. And I said, yeah, that would be great. Let me know what steps I have to take or if you need anything from me. And a couple of weeks passed and she did not respond to my messages, so I figured she was busy. So I followed up again and I said, hey, I'm just following up on the last email that you sent me regarding possibly being able to bill my secondary insurance so that I could keep seeing you. Let me know if you received it or what is the process as far as all of that is concerned. And again, she did not reply, which at this point kind of made me feel bad, right? I felt like, well, maybe she just doesn't want to see me anymore, or maybe she's busy, whatever it is. I didn't want to go as far as sending her a third email because it was just getting to be too much at that point, right? So that's when us, ADHD or HDADers or neurodiverse people tend to have. I think we tend to be more sensitive to rejection than most people. There's such thing known as RSD, which stands for rejection sensitive dysphoria. Although there's not much research or literature on it, it is said to be common for people with ADHD, where we don't do so well with being criticized or rejected. And I think that part of the reason why I felt so bad when I didn't get a response from my previous therapist is because of that, right? Because I know I'm typically very sensitive in general, not just to rejection. I'm just a very kind of empathic and sensitive person overall. So the fact that she didn't even bother replying to my email did kind of make me feel bad. But then I kind of tried to tell myself, it's probably not personal. She's probably busy. So I guess we just have to be mindful of like our cognitive distortions, right? Like we tend to think that everything is about us or take things personally, where most of the time it probably really isn't, right? Well, anyway, at that point, instead of sending her a third email to ask her again about whether or not she'd be able to take my insurance, I just went ahead and did a search for a provider or a therapist that took my current primary insurance, which is Anthem. And then I saw her about 2 weeks ago. And she told me, I did the intake questionnaire and we kind of did the very first session was more of get to know you type of session. She asked me how long I've dealt with anxiety, depression, and all these things. And I told her it's been as long as I can remember, I've dealt with anxiety and depression. And she asked me if I thought the medication helped. And I said, it does kind of offset some of the symptoms, but I kind of always feel like I'm depressed on some level, like I'm never really happy, or, just the depression is always there. And she asked me what other methods I've tried to treat my depression. And she brought up this thing called TMS, which stands for transcranial magnetic stimulation, which is basically you get some things hooked up to your skull and it sends pulses, electric signals to your brain to activate the parts of your brain that are said to be dormant or less active in people who have depression, and that is said to play a part in why we are so depressed. And so that was pretty cool. So I looked into that, and there was one place that I called that quoted me about almost $6,000 for 30 treatments because even though they take my insurance, my deductible has not been met yet. So because I haven't met my deductible, I would have to pay for the majority of it out of pocket. There's another place that told me they would get back to me once they took a look at my insurance and see if there would be any out-of-pocket costs for me. But yeah, it's expensive, but it's definitely something that I'm interested in trying because I feel like I've been in traditional talk therapy for so long and I've already tried a million different medications that I would definitely be open to trying something out of the norm. In my previous video, I talked about how I recently interviewed for a speech and language pathologist position at a charter school, and I actually ended up getting the job, and I'll be starting probably sometime late October or early November, which is really awesome. And I have a video where I talked about that a little bit. And the reason I bring that up is because it kind of goes back to that cognitive distortion thing, right? I have this thing where I tend to feel like I'm less than people, like I'm not good enough to, you know, like most people are better than me at certain things. I tend to feel very small. My self-esteem is very low. I don't have very much confidence in myself at all. And then when I went in for the interview, I felt like I did okay, but then I also felt like, I'm probably not what they're looking for. They probably want someone with more experience. I look at myself and I think that a lot of people maybe look at me and think of me as like they look at me and they never think that I'm the age that I am because I look young and I'm very short. So they don't treat me, or at least a lot of the times I feel like I'm not taken seriously because of that, because of my appearance, because of my disability, and because I feel like I'm not taken seriously a lot of the time. That kind of contributes to me feeling not good enough or less than other people. But a couple of days later, I got a call back from the special ed director, which was one of the people that I interviewed with, and he offered me the job, which means I must have made a good impression, right? I answered the questions to the best of my ability, based on my knowledge of speech and language disorders, based on what I've learned in school and what I've learned working as a reading specialist with kids with special needs. But even then, I kind of walked out of the interview feeling like I didn't do so well, like I wasn't good enough, but still I got a call back. So that kind of goes to show me that I'm much more capable than I feel. I'm much more capable than I think I am. And I think that probably goes for a lot of us who have a disability or are neurodivergent or suffer from anxiety or depression. We have all these cognitive distortions and false beliefs about ourselves that we're not good enough. When in reality, I think we are more than capable of doing the things that we want to do. But it takes time to kind of reframe your thinking and find those cognitive distortions, those, in some cases, core beliefs that you've had about yourself your entire life, and kind of try to reframe your thinking and turn them into more positive, more realistic thought processes. But yeah, I just wanted to kind of point that out and try to end on a more positive note and have you guys kind of reflect on that if you also suffer from anxiety and depression and social anxiety in particular. See if you can find what are those core beliefs or cognitive distortions that are making you, I guess, feel that way about yourself, and how realistic are they? But anyway, that is it for now. I will be back.